Hi, my name is Dr. Robert Antolak at thegentle.dentist.com. We're located in Macomb County and in Shelby Township, and I want to talk to you about periodontal disease. Periodontal disease affects about 50% of the adults in America, and it accounts for the majority of tooth loss in adults. Periodontal disease is an infection of the teeth and the bone that surrounds the teeth. This infection is a bacterial infection from when there are certain bacteria that live below the gums that cannot tolerate oxygen. They're called anaerobic bacteria, and these bacteria form down there and they kind of live. They have a colonies, they have their own little microenvironment, and if they're not altered or adjusted, they will continue to repopulate and grow, and which will inevitably affect the support of the teeth. Now, there are systemic issues that are also involved with periodontal disease. For example, someone who has diabetes is more prone to having periodontal disease and bone loss. And those who are diabetic have that, and vice versa. Those who have periodontal disease have a risk of having diabetes. One helps and engages the other. So if one is able to control their blood sugars, then they are able to then help control their bone loss and diabetes at the same time. Also, people who smoke are at much more risk for having bone loss. I find in my own practice that there are people who come in the office and almost immediately, 90% of them, I ask them if they're a smoker, and they say they are. When I see there's bone loss around on the x-rays, it shows bone loss, and also when we use what's called a periodontal probe. Periodontal probe is the instrument that's used by your dentist or dental hygienist, and we basically go below the gum line here to test how far, where it is. Normally a reading of less than 3 millimeters, which is this first increment on this probe here, the reading of 3 millimeters or less is a sign of health as long as the gums aren't bleeding. If it goes below 3 millimeters, that's a sign that you have bone loss. This bone loss over time takes place, and it loosens the teeth up because you don't have the bone there. And it's important that when you do go to your dentist, that them or the hygienist goes around each tooth. There's actually 6 positions on each tooth that is probed, and it gives us a map, a chart of the situation where the gums are and where the bone is. Healthy teeth and gums do not bleed, and bad breath can come also from gum disease, which is, like I said, a bacterial infection. The best way of treating gum disease is by what's called scaling and root planing, and this is to take care of the periodontal disease. And the scaling and root planing, what it will do is you'll get numbed up, and the hygienist will go below the gum line and scale off in the surfaces, the contaminated surfaces by these anaerobic bacteria. So it usually takes 4 to 6 appointments to adequately take care of all the areas of the mouth. It's also very important that once this is done, it's not done forever. Once you have gum disease and periodontal disease, once you have that, you basically always have it, and it's just a matter of controlling the factors that cause periodontal disease and the bone loss. So usually every 3 to 4 months, it's important, no matter what your insurance says, to come into the dentist to have this area debrided and that the bacteria is disturbed. These bacterial colonies are very organized areas, and if oxygen and disturbing them through professional cleanings, you can limit the amount of bone loss that takes place after treatment. Also, we find that people who go through this process, also their the hemoglobin A1C levels are better off, and their diabetes is more controlled, and they have to use less medications because their body, their systemic body doesn't have to either fight off the infection, and the chronic inflammation that takes place from the gum disease improves the situation. So diabetes is controlled, and also other systemic issues like, for example, heart disease is at much less risk when periodontal disease is taken care of. So if you do have any questions about this, you can feel free to give us a call. Our phone number at the office is 586-247-3500. Also on our website at The Gentle Dentist, you can look and see on services, and you can see where I describe this in much more detail. So if there's any questions, please give us a call. Thank you.